The following production is a live procedure placing zirconia anterior kinder crowns, all ceramic pediatric crowns, on patients who are affected by early childhood caries. Dr. David Collier, DDS, a pediatric dentist at Koala Dental Care of St. Cloud, Minnesota, and a staff clinician at Gillette Children's Hospital of St. Paul, Minnesota, performs the procedure.
I start my procedures by approximating the crown size that best fits the tooth. This is done by holding a crown up next to the existing tooth to gauge the proper size. Next, you begin your preparation. Preparation is very similar to that of plain stainless steel crowns, but it requires slightly more tooth reduction. This increased reduction is necessary to properly fit an appropriately sized crown, making the restoration as natural looking as possible. Based on my experience, you will need an extra 15 to 20% tooth reduction. With the increased reduction, you should anticipate more hemorrhage than with a stainless steel preparation. In my initial preparation, I use a 1.8 millimeter football-shaped diamond burr. Using the adjacent teeth as points of reference, reduce the incisal 1 millimeter. Proper incisal reduction will allow the crowns to seat passively and subgingivally 1 to 2 millimeters. After the initial preparation is complete, I visually check that the top of my burr is approximately even with the incisal of the adjacent teeth. Next, circumferentially reduce the tooth 1 millimeter, following the contour of the natural tooth, ending with a feathered margin. Use a flame-shaped diamond, such as a 368 or 330 tapered carbide. These burrs provide a nice feathered margin, which is recommended. During the interproximal reduction, I recommend keeping the burr parallel to the tooth. This will reduce the likelihood of contacting the pulp when treating vital teeth. Again, proper reduction will allow the crown to seat passively and subgingivally 1 to 2 millimeters. Now, I remove any remaining decay with a slow-speed round burr. Next, check for any pulp exposure. If you find exposure, treat the pulp as necessary. If there is no exposure, then go to size verification and preparation refinement. Now try your selected crown size and verify the crown fits passively and completely. The most important key to remember when placing zirconia kinder crowns is that a passive fit is required. In other words, avoiding a snap fit is critical, because it can create excessive pressure causing the zirconia structure to fracture. A passive fit allows the crown to slide on and off the preparation without any resistance. Anterior zirconia kinder crowns are available in 2 lengths, regular and short. The regular length crowns are equivalent to the plain SSCs in size, and the short version is approximately 1 millimeter shorter. The length you should choose will depend on your preparation technique. In my opinion, it is best to consult with kinder crowns for help in deciding which length you feel most comfortable seating. Kinder crowns are available contoured or universal. I prefer ordering universally contoured kinder crowns rather than lefts and rights because it reduces the inventory I need on hand. During size verification and preparation refinement, I use fit check crowns. They are precision milled to ensure proper fit with no intraoral contamination. They are easy to clean and have a rough external surface for enhanced control during preparation refinement. When placing the crowns, you must use light finger pressure. If the crown won't go to place without resistance, you will need to reduce more tooth structure to ensure a passive fit. The majority of the preps that I've seen where the crown failed to seat properly, there was inadequate subgingival preparation. Often there is a remaining band of tooth structure just below the tissue. Removing that tooth structure is the key to achieving a passive fit. Next, rinse the preparation and crown to remove any blood and debris. If hemorrhaging continues, apply pressure using a 2x2 or copper cap until hemorrhaging subsides. Some clinicians use a hemostatic agent to speed up this process. Prior to cementation, it is important to thoroughly clean the crown with alcohol or Ivoclean. After your crowns have been thoroughly cleaned, completely fill them with your cement of choice. If the crown is not completely filled with cement, Blood can get inside the crown, causing the restoration to discolor over time. This cementation technique also removes inadvertent voids in the cement, ensuring proper retention. Many dentists are using a resin-modified or straight glass ionomer with Zirconia kinder crowns. I personally use a glass ionomer and mix it slightly thicker than normal to aid in keeping the crowns in place. When seating multiple crowns, you should seat centrals first, then the laterals. Excess cement can be wiped away or rinsed off the facial to help you properly position the crowns. Once placed, apply consistent, even pressure. Do not disturb the restoration and allow the cement to set according to the manufacturer's guidelines. Now use an explorer to clean up any excess cement. While doing so, you should also confirm that the gingiva is reflected and crowns are seated all the way. I also like to use a Profi cup and paste to clean up any unseen cement. If you need to sterilize a Zirconia kinder crown, I recommend autoclaving. Prior to autoclaving, you may need to run them through an ultrasonic cycle with alcohol or hydrogen peroxide to remove blood and debris.